So I wanted to kind of go through how we plan for places to present as the Cancer Cares and Racial Equity Study went along. Okay. And so here, I'm just going to tell you that even while we were writing the proposal, I think it's important for you to see, because it is a CBPR approach, that it was like a group. It was a group written proposal. Usually PIs just sit in their office, right, Meg? We sit in our office and we just write. It's just isolated, you go down under, you don't answer emails, you're just all by yourself getting that thing written, and then you might send it out to a reading team, so there might be three of your peers who would read your proposal, give you feedback on it. I mean, RTI has a whole procedure for doing that and making the revisions, and then it goes to whoever the funder is. Here, we were submitting it to the National Institute of Health. This was actually submitted to National Cancer Institute, NCI. And so you can see here that we began this work in earnest from October to January. And so this is just the proposal writing. And we had a research question committee, we had a methodology committee, we had an analysis and dissemination committee. So already dissemination was discussed even while we're writing the proposal. And we had a reading committee, and then we had a budget committee. And you could be on several committees, but every committee had to have an academic, and every committee had to have a community partner. And actually Michael, because he was learning the CBPR process, he wanted to be on every committee. And he was.
Wow.
Just so he could learn, of the kind of conversations that went on. And during these stages, just like in anything with CBPR, conflict emerged, right? And conflict emerged with the budget committee. But it was good that it emerged then. And you have to, it's amazing what you have to explain about the underbelly of the university and overhead. And raises, and what's allowable and what's not allowable, which caused a lot of tension, and subcontracts, and salaries, and all that. So so conflicts arose. We actually had one person leave the collaborative, because he just didn't like it. He didn't like it, and so he left. But his wife is now president.
Is that a timeline? That's not a timeline.
October, no, it's October to January, and it was very iterative, but nobody could move forward until the research question committee did their work. And it was very important. It was a big learning process for everybody on how tough it is to come up with a good research question. Those of you in doctoral programs know that that's probably the toughest thing, is coming up with a researchable question worth asking, and that it can be answered in a doable way. And that's what the methodology that we look at. So there was some overlap. I'll tell you also that we came up with a very innovative methodology, which is critical incident technique interviewing to interview. You'll hear more about that. And so here are the research questions. As Jennifer was saying, we are more of a systems focused, looking at anti-racism as a systems issue. And so it's systems change. It's not cultural competence. It's not behavior change, but how do we change the system? And so the question was, did African American and white women with breast cancer in Guilford County receive treatment at Cone Cancer Center that was the same? If the breast cancer care was not the same, how was it different, and what could have been the reasons? And then so the study design, exploratory mixed methods using CBPR approach. We also analyzed the cancer registry data, so that's the data of the system. They collected that themselves. And then we decided to collect primary data using critical incident technique interview. And anybody in here know what it is? It was developed, well, Janet, okay. Because she was an RA for this, okay. But the critical incident technique interview was first defined in 1947 by a man named John Flanagan. And this was developed actually to kind of understand about plane crashes. So survivors, pilots and navigators, survivors of plane crashes, he interviewed them, this is all during the war, to find out what was wrong in the system, what went wrong in the system that they had a crash. What was the control tower? what were you eating? I mean, it was just all the things about their interactions. What were the critical incidents that led to that crash? What were the positive things and what were the negative things? And so it's a particular qualitative technique to do this kind of interview. And then you take the findings then to fix the system, to try and prevent crashes. And so we did critical incident technique interviews with white and African American breast cancer patients who completed their treatment at Cone 5 years earlier, for them to go through the critical incidents. And they were wonderful, and that's what they said. They said they'll never do it in a focus group because it's a very private, painful experience. They'll never just do it as an ethnographic interview because they don't have words really it needs to be more guided and more structured. And this way, you do it, the first time we did it, we had scheduled 3, that we would interview them 3 times. And it'd be the same interviewer, and we would train community people to do those interviews, because it would need to be that, because it's such a cathartic experience for the women. Okay.
And they were matched by color.
And we matched them by color.
White women interviewed white women, and African American women interviewed African American women.
Mm-hmm. And we went through a whole interviewer training, and I remember Netticode was saying when we call them to schedule the appointment, the first thing we need to say is, I'm not asking for money. Mm-hmm. Because many older women, you know, they're afraid of being scammed, right? So to do that, but there's a whole script that was led up. And so I'm just going to, let me just go back to this. So when we got the proposal and we got the funding. And so the first 2 things that we thought we needed to co-present one was to have a press conference, to do a press release, and we did it at the public library to announce that we got the grant. And so we organized a presentation of our partners, and we invited many of the stakeholders in the community, and we put it in the newspaper to announce what we were going to do together. And so that co-presentation was, I remember Michael and Nora and then Bob and me, and so we were, one explaining the anti-racism framework, one explaining CDPR, and then one explaining the actual study design. So we had like 3 presentations. So that was the first presentation. And then the second one was, Michael Jonas was like, when he went through this whole thing, he said, this is so unusual, the way we wrote the proposal. This is just so great, what we just did. We should present this about how we wrote the proposal, and then, you know, we say, ta-da, and we got the grant. You know, here we have a community group that got a grant from the National Cancer Institute. And so then we chose, so we went through the guidelines and chose, so he would present, because he needed to present as a postdoc, but who from the community would co-present with him? And so that was a discussion, because the presentation he submitted the abstract to was for Toronto. So they would get to go to Canada and co-present in Toronto. And some people didn't want to go, some people didn't have passports, some people could, you know, and so we had that whole discussion. Oh, what happened? Sonia?
What happened?
It just went out.
It's on the screen up there.
Oh, okay, I can see it here, all right, sorry.
Oh, touch the screen. Touch the actual screen.
What?
Touch the screen. Touch the screen. Does it come back now?
No, doesn't matter,
Oh,
okay.
sorry.
And so Nora Jones, whose husband was one who left the collaborative, she stayed with the collaborative, and she had never presented before. She was a French teacher, retired French teacher, so she could speak, but it was a lot of encouragement from the collaborative that this would be really great for her. And so she went and co-presented, and then there was going to be a special issue coming from that conference. And so Michael and Nora and the collaborative decided that they would like to submit a manuscript to see if it would be accepted into this special issue on the process that we went through. And we wrote it together. We had one, Nora, who was great, who was a French teacher, and I was going to be a French teacher too, but she was wonderful for catching grammar, typos, semicolon, colons, and all of that as well. So we each had different things that we contributed to it. Okay. And so when the results were done, then we were trying to decide, okay, we've had these fabulous critical incident technique interviews, and went to the cancer registry, and we found that their cancer registry was really poor. It did not allow us to analyze the data by race. There wasn't enough detail in there to look at disparities in treatment. They didn't collect enough, and so they eventually outsourced the cancer registry to somebody else. But we felt it was important for us to present the findings first to the women, because they shared their stories. There were 50 women, and that was very private stories. And so we wrote a small grant to pay for the money, because NCI would not pay for food, to host a private dinner. It was a sit-down dinner, tablecloths, everything in Greensboro, and they were invited to hear the findings first. And then to help us interpret the findings, and then also to help us think about what the next grant should be. So that was done first. And then our second presentation of the findings was to the doctors and the navigators at the Cancer Center, because we didn't want to air their dirty laundry. We wanted them to be to be a stakeholder, and to see the findings, and to understand that we really are trying to make it better, and that we committed to an intervention. And so that they could see that there was implicit bias happening in their cancer treatment. But they wanted to know why, and so did we. And so we said, okay, so let's write this grant together. So they were on board. And then we had the public forum, and that was held at the library. Yeah, it was held at the library. And it was announced, and people came, and that's what that, at the bottom, the photo there, you can see the different people who came and would speak and ask questions. And so they knew, and so this was all just part of the importance of CBPR, of really respecting people who gave you the data and to disseminate to them. And so over the 3 years that we conducted CCARES, we did 9 conference presentations, some of which were invited. We did 6 state or local conferences, and we did 5 interviews, these talk shows on local stations. We developed a website. We made presentations to students. We did a lot of guest lectures. We also presented to medical residents at Cone. We did a lot of presentations to community groups. And so again, we would figure that out. And then then you see for the member checking forms that I just showed you photos of the number of patients that came, the number of providers that came, and then the number of community that came to our forum. So we wrote 3 academic journals, 3 peer-reviewed journals for book chapters. And then after this funding period, we've written 2 more. Okay, Gary?
The breast cancer patient dinner, it looks like there were 20 interviewees who came.
Out of the 50.
What was the mechanism to reach out to the other 30?
I mean, we sent them all very nice invitations to come, but only 20 came. Is that what you mean?
Yeah, did you find out why the 30 folks didn't? Okay.
No. And then, it was interesting, and then a couple of them who came to the dinner came to the community forum and were willing to stand up and to talk about this. Dottie?
So the breast cancer patients were not part of the collaboration,
No,
right?
because we had to randomly select them, yeah.
Oh, okay, so did they get involved anymore? I'm really
Actually, after this, then
interested
Sisters,
in how they use this information that you.
a chapter of Sisters Network.
I think there's two pieces. One is that there were women in the collaborative who'd had breast cancer. And the reason we ended up selecting breast cancer is that when we had discussions about our experiences with race and racism in healthcare settings, and in talking with each other, breast cancer kept rising to the top as an issue that everybody in the room had encountered, either personally or with their family or whatever. So that's how we ended up with breast cancer. But then in terms of several of the patients expressed a concern about there not being adequate support for African American women, including some of the white patients. And as a result of this, the executive director of the Partnership Project founded a chapter of Sisters Network, which is a national survivorship organization for African American breast cancer survivors in Greensboro, and it's now finished with its 3rd year as an organization. It's a very strong and powerful organization. It came directly out of the conversations that we had with the breast cancer patients.